you, sir, for your presence. From Udhampur constituency, posts in the.
Good afternoon. Seated on the dais, our very dear friend and a very precious colleague, Padma Shri Dr. V. Mohan. I am doubly delighted this afternoon. This program has been organized by him and also dedicated to a concept and the idea which was for the first time floated by him. And it gives me a special joy also to recall that there has been a very close professional as much as a personal association with Dr. V. Mohan and in fact the entire family. He was recalling the Chennai connection. We share a common alma mater in the form of Stanley Medical College. I don't know how many of you in this room are aware of the fact that his father, the legendary Dr. M. Vishwanath, is still remembered as one of the fathers of diabetology in India. He, along with Professor M.M.S. Ahuja, Professor Sam Moses and some others, were the first to give the concept of diabetology as a separate area of study, research and practice. And I think he was also among the first in Madras, which is now known as Chennai, to have started a nursing home, which was at that time known as the Vijay Nursing Home, and we were students. And incidentally, Dr. V. Mohan was my senior and his younger brother Vijay was my junior. So in the middle of the family. And I'm glad that this association has always consistently grown from one level to the other, both professionally as well as personally. We've also maintained, and thankfully, I'm thankful to God Almighty, we've been able to maintain contact with each other. And very recently, just about 3-4 months back, the Lifetime Achievement Award, which was conferred on me very generously, very kindly, at an international conference in Chennai, as a medical professional. The conference also was organized by Dr. V. Mohan. So I have to thank him for that as well. But that apart, Dr. V. Mohan is today known across the globe for many firsts to him. I think he was among the first who started an exclusive diabetes healthcare center and a healthcare facility. And that's how Madras gradually came to be known as the diabetes capital of India, not because of its higher prevalence, but also because of the higher standards of diabetes research and a pioneer in doing so. And he was also among the first to have raised the V. Mohan Center, the Madras Diabetes Center, to international levels. It's now a center which is often referred to, quoted to, in any conference of repute across the world. He was also the first to have been globally hailed for having produced maximum number of diabetes-related published papers from a single institute year after year for several years. And I think if the cameramen are blocking me, the others can clap for him. And he's also the first time, I think, a full-time diabetes expert, researcher and scientist who was recognized by the government of India with a Padma Shri. So there's been series of countless national and international recognitions and awards which Dr. V. Mohan has been conferred, but he has carried on with a single pursuit unidirectionally, and that is something that each one of us should be learning from him. And therefore, this now also becomes a matter of concern for Jammu and Kashmir. Whereas overall in India, you have 1.1 crore type 2 diabetes mellitus and 1.36 pre-diabetes. Now the significance here is that even before the symptoms appear or an overt diabetes is detected, you could have affected your organs. You could suffer from a myocardial infarction, you could suffer from an early nephropathy and then only get to know that you actually were a pre-diabetes or diabetes. So it's become equally important to detect it at this stage, also because And I think that's again something alarming. Overall in the country, 70% of mortality today is because of the non-communicable disease. And many of that mortality is contributed by the symptomless factors, symptomless conditions like pre-diabetes. And therefore, and yes, of course, we also once did a small survey where we noticed that every third patient visiting the OPD for any disease, he might go there for an ENT issue, or he may even go there for a gynae check, is found to be, when you go through a screening, is found to be having diabetes or pre-diabetes. So that is the why it's virtually become an epidemic. And therefore, I always say now it's no longer an issue concerned only with the medical professionals. And I say diabetes is too longer and too serious a problem. It has actually become too serious an issue to be left to a diabetologist alone. It's virtually become a national concern. Something like government medical college, we should not be hesitant in involving the private sector. At the same time, private sector should also follow some of our priorities. For example, if they are opening up a new corporate, they can open up a small ancillary branch in the rural area. So that is how it would work. Because if earlier on, and this government is quite open, and thanks to Prime Minister, because earlier on there was a lot of skepticism between the private and the public. The public sector always thought of the private sector as black marketeers, policers. The private sector thought of public officials as bribe takers, as scammers. Gunda bhi baithta hai, chor bhi baithta hai, डाकू bhi baithta hai. So you have sadhu sitting there, you have shaitan sitting there. You have sinner sitting there, you have virtue sitting there. But suddenly when the bus breaks down, the tire gets punctured, which used to happen very often in my and your times, then what does happen? Everybody gets down and starts pushing the bus. They forget who is each other's vices because the destination is common, the objective is common. So if we have to achieve this objective and achieve this effectively, we have to give up these barriers of the public-private. And why I'm saying so is that we have walked the talk. Just about 3 months back, we came out with the National Research Foundation through the Ministry of Science and Technology. Also, we are the first in the world, among the first. Only America had one, that is called National Research Society. Germany has one. We have come out with a better version. And very consciously, not only 70% of the resources from the private sector, we have also given representation not only exclusively to the scientific fraternity, but also to humanities, to social groups, to also human resource development, who can give a flavor of our culture, our context, while planning our scientific programs. Project structure befitting the requirements across the world, and also could advise on what kind of collaboration do we have. Because if we are thinking of Viksit Bharat, easily said than done, then we have to live up to global challenges. We have to have global parameters. We have to have global strategies. And there also we have started making headway. We were in Global Innovation Index, we were just 81 10 years back. Now we've jumped 41 places. And startup ecosystem, we were nowhere. Today we are ranked 3 in the world. So that means we have the capacity of doing so. There was possibly not enough of support from the levels of the policy makers or the government, which is now happening. And there is also one of the better times happening, because I can foresee that J&K hereafter is going to contribute to the overall growth story of India. And without evidence. The point is, when we talk of rising to that pedestal 2047, most of us talk like politicians, most of us talk like public speakers. But when we talk of it as scientists, how do you rationalize it? From fragile 5, we are now top 5. 10 years back, we were fragile 5 economies, and it was said that any time they will be going haywire. But in COVID, we did better than many of the other economies which are just having 500,000 population. And therefore we proved it. But now, how do we reach that 2047 pedestal? Now we will have to explore all those resources which have remained either underexplored or unexplored. And those resources will come from regions like Jammu and Kashmir. To my mind, we have 2 main vast resources which have remained unexplored by the earlier governments. One is the marine resource. We have 7,500 long kilometer coastal area beginning from Odisha, Bengal, here up to Maharashtra, Gujarat. And it's a huge wealth of metals, minerals, biodiversity. Otherwise, the other day I was telling a civil servant, I said, very soon you'll have to have a secretary for illegal mining in the seabed. And we have started that deep sea mission. Prime Minister spoke about it for the ramparts of Red Fort, though people have not yet realized it because when the results start coming. So the value addition to our economy is going to be there. Because all other sources, IT, etc. exhausted. Other is going to be our Himalayan resources. And those states, territories will lie in the bed of Himalaya. Whether Jammu Kashmir, Himachal Pradesh, Uttarakhand, Arunachal Pradesh. Already we have started, Aroma mission started from Jammu and Kashmir. A new genre of agri startups in the form of lavender cultivators has emerged. It's become popular all over the world. Prime Minister spoke about it in Man Ki Baat also. And therefore, I think the findings of the ICMR India Diabetes, I am sure media will be kind enough to give it due coverage. And I would also request, and we will also do it, we'll prepare small clippings for social media. Because we have seen that even many of the scientific work doesn't find enough slot. Technology is so strong that we don't need it. We conducted a longest ever coastal cleaning campaign in 22 clippings, because people are watching just 2 minutes video or 30-second reel, which you can produce better. And the access is through that. So we can generate awareness. We can generate awareness through infographics, through information dissemination. Also, these are some of the lesser known facts. And of course, with the kind of access and influence that Dr. V. Mohan has across the society, that could be an asset to all of us. And I think my only hope is that we are able to pick up the right kind of cues from the presentation made by Rajiv, also take the right kind of measures and succeed putting Jammu and Kashmir in the main course of the mainstream journey of India, both in healthcare as well as in adding to the economy. And the two are very closely interlinked. And that's why I said it's not only a concern of those few in this room, it's a wider concern. And I'm sure each citizen will be able to contribute. That's exactly what is being envisaged when we talk of the Gold India 2047. Thank you very much for the patient hearing.
ICMR के सौजन्य से और कुछ डायबिटीज़ के विशेषज्ञों के एक ग्रुप ने मिलकर के एक देशव्यापी एक स्टडी की, शोध किया था, जो अपने में विश्व का सबसे बड़ा शोध रहा है सर्वे के तौर पर, जिसमें कोई 1.25 लाख 1.5 लाख प्रति डिस्ट्रिक्ट भारत के हर ज़िले से एक रिप्रेजेंटेटिव सैंपल की टेस्टिंग की गई। स्टडी का नाम था ICMR इंडिया डायबिटीज स्टडी। और इसमें हमारे साथी डॉक्टर वी मोहन पद्मश्री मद्रास डायबिटीज रिसर्च फाउंडेशन के जो चेयरमैन भी है, हमारे मित्र भी है, हमारे सहपाठी भी है मेडिकल कॉलेज में दिल्ली में, उनका सौजन्य था। और हमने इसको किश्तों में रिलीज़ किया है। दक्षिण भारत का सर्वे रिलीज हो चुका था, कुछ एक उत्तर भारत के प्रदेशों का भी, दिल्ली का भी, जम्मू कश्मीर का रहता था क्योंकि यहाँ पर चुनाव इत्यादि हुए। और जो जहाँ पर भी इस रिपोर्ट को रिलीज़ किया गया, इसको बड़ी व्यापक ढंग से प्रकाशित भी किया मीडिया और संबंधित स्वास्थ्य संस्थाओं ने इसका संज्ञान किया। आज हम पहले चरण में जम्मू की डेटा रिलीज करने में सफल रहे हैं। आने वाले समय में कश्मीर और लद्दाख का भी डेटा हमारे पास तैयार है, उसको भी रिलीज किया जाएगा। कुल मिलाकर के देश भर में लगभग 1 करोड़ से अधिक डायबिटीज़ से पीड़ित लोग हैं और प्री डायबिटीज़ से उससे भी अधिक, लगभग 1 करोड़ 36 लाख। प्री डायबिटीज़ जबकि शायद कोई लक्षण ना हो, लेकिन वो हार्ट पर, किडनी पर, आँखों पर असर कर सकता है। इसी प्रकार से जम्मू का अगर से देखा जाए तो जम्मू के 10 जिलों का जो ये सर्वे बताता है कि यदि औसत हमारी प्रतिशत 16% तक है, तो जम्मू के 10 जिलों में उतनी या उससे थोड़ी ज़्यादा ही कम, यदि 17-18%। जिसका मतलब ये हुआ कि आने वाले समय में जब हम विकसित भारत की बात करते हैं और प्रधानमंत्री मोदी जी ने हमारे आगे ये लक्ष्य रखा है सब 2047 के भारत का, तो इसमें प्रमुख तौर से युवाओं की भूमिका रहने वाली है, उसकी रचना में, उसके निर्माण में। और इसलिए ये केवल डॉक्टरों तक या डायबिटोलॉजिस्ट तक ही सीमित एक दायित्व नहीं है, ये हमारा सामूहिक दायित्व है, क्योंकि प्रत्येक नागरिक का योगदान रहेगा विकसित भारत के निर्माण में कि हम डायबिटीज़ और इस तरह के अन्य जो मेटाबॉलिक डिसऑर्डर्स हैं उनकी रोकथाम सफलतापूर्वक करने के लिए कोई योजना बनाएं, स्ट्रेटजी बनाएं, ताकि इन युवाओं की ऊर्जा, इनकी क्षमता किसी बीमारी की भेंट ना चढ़ करके राष्ट्र निर्माण के काम आए। और इसलिए हम ये भी चाहेंगे कि सारा कुछ सरकार पे ना छोड़ करके, हालांकि मोदी जी के आने के बाद योगा डे भी आया, आयुष का अलग मंत्रालय भी बनाया गया, अब मोदी जी की कल्पना से 1.5 लाख वेलनेस सेंटर बनाए जा रहे हैं देश भर में, क्योंकि वेलनेस का अर्थ केवल एब्सेंस ऑफ डिजीज ही नहीं है, उससे कहीं आगे बढ़ करके है। इसी प्रकार डायबिटीज़ की मॉनिटरिंग भी शुरू की गई है। लेकिन साथ ही साथ इसमें जो हमारे सामाजिक संस्थाएं हैं उनका भी योगदान रहेगा, ताकि हम इसको सकारात्मक रूप से सफलतापूर्वक इस पर अंकुश प्राप्त कर सकें।
थैंक यू।